If you are struggling with any form of urinary incontinence or pain with intimacy or any sort of pelvic floor dysfunction and you've talked to your doctor about it, chances are good that they have recommended that you do Kegel exercises. You may have already tried the Kegel exercises and felt like they did not help solve your problem. Or you may struggle with difficulty knowing if what you're doing is actually a proper Kegel exercise. Or you may be doing the Kegel exercises, but you're wondering if you're doing them correctly because you're not getting the results that you were guaranteed. So today we are going to discuss the biggest misconceptions with Kegel exercises. I'm Dr. Amy, PhD trained orthopedic manual physical therapist, and I am empowering women with changing bodies to move pain-free. So a lot of people wonder if I am a pelvic floor therapist. And although I do work on the pelvic floor is part of the greater body. It is connected to everything else. Like it is literally the core of our core. I treat the pelvic floor as it relates to every other area of your body, which means we treat the pelvic floor often in conjunctions with other painful areas. So what typically happens in my clinic is that women come in and they're having hip pain or low back pain or SI joint pain. They can't do the activities they want to do, running, jumping, exercising, sometimes even just things like cleaning the house or picking up their child. And all of that may be due to a pelvic floor dysfunction. While there's another group of women who come in specifically for pelvic floor dysfunction. They're having urinary incontinence. They're having pain with intimacy. They can't jump on a trampoline. They pee a little bit when they laugh, cough, or sneeze. And they're wondering, is this just normal? Well, friends, I'm here to tell you today that it is very common after you've had children to pee a little bit when you laugh, cough, or sneeze, but just because it's common doesn't mean it's normal. It's just for some reason what we have accepted in our lives that we've had children, so we just have to put up with this for the rest of our lives. And that's horrible, because what we now know is that those women who put up with that pelvic floor dysfunction in their 30s and 40s become the women who in their 50s, 60s, and 70s need to get a total hip replacement. If you have been doing Kegel exercises to help fix this problem of peeing when you laugh, cough, or sneeze, or even if you have a bigger issue with urinary incontinence or pain with intimacy, I'm here to tell you that chances are you are doing the Kegel exercises correctly. However, the chances are also 100% that Kegel exercises are not what you need to be doing. I'm going to side note for just a second here because I can already see the comments appearing where people are going to say, hey, it's actually pronounced Kegel exercises. You're right, it is actually pronounced Kegel exercises. However, when I see it in my head as I'm talking, I always think of Kegel exercises because that's what we called it when I graduated from PT school 25 years ago. So I please apologize. I will probably continue calling it Kegel exercises. I do understand that it is actually Kegel exercises, and I hope that we can all agree to let me slide on this one. What I can tell you is 100% of the time in my clinic, when I have patients come in with a pelvic floor dysfunction, it is not a problem that their pelvic floor is weak, which is what Kegel exercises would help with. It would help to strengthen the pelvic floor. What these women are suffering with is that their pelvic floor is tight. What I like to use is an analogy of your hand and a fist. So go ahead and take your hand and make it into a fist and really try to squeeze. Squeeze it as tight as you can. Squeeze it as tight as you can. Okay, now you're going to hold that for 30 seconds. And then in 30 seconds, you're going to try to squeeze more. Well, now you're looking at me and you're saying, Dr. Amy, you told me to squeeze it as tight as I could. I was squeezing it as tight as I could. In 30 seconds, a minute, 2 minutes, I'm not going to be able to squeeze it anymore. And you're right. This is what is happening to your pelvic floor. So your pelvic floor is tight, and chances are that it's squeezing as hard as it can and it's holding everything in all the time. And so then your bladder gets full and you laugh, cough, or sneeze. And it's like, I got no more to give, Captain. I'm giving it everything I got. So if you have a tight pelvic floor, there's no way it can contract anymore. Which is why I get so frustrated about these Kegel exercises, because women are told you just need to strengthen your pelvic floor. It's not a strength issue. It's already strong. It's just tight and there's nowhere for it to move. Muscle fibers slide on each other. So you contract, they come closer together. You relax, they come further apart. Contract closer together, relax further apart. If you contract, if it's already contracted because you have a tight pelvic floor, and then you try to contract the muscle actively by doing a Kegel exercise, what is that muscle supposed to do? It's already fully contracted. Now, it could be that your pelvic floor has some areas that are tight and some areas that are stretched out. This is very common when I see people who suffer with an SI joint dysfunction. So basically their hips are not at the same level. This puts an abnormal stress on the pelvic floor on one side, gets contracted, the other side may get stretched out. So it could be that the stretched out side would be diagnosed as weak. But if it's fully stretched out, now you've got the opposite problem. So again, you contract, you relax, you contract, you relax. So let's say you're in that relaxed stage and now there's tension on it. How are those muscle fibers supposed to contract? You have to fix the SI joint malalignment issue. In that case, you have to, in order to be able to get the pelvic floor in the optimum position to be able to contract and relax. You see, that's the thing. Often a pelvic floor dysfunction is considered its own issue. However, my question is always, why did this pelvic floor become dysfunctional in the first place? It could be due to an SI joint malalignment issue, as I discussed before. It could be due to core weakness. It could be due to low back pain. It could be due to poor posture or poor movement patterns throughout the day. There are so many things that could be causing increased stress to this pelvic floor, which can cause it to become tight as opposed to weak. So here is your permission slip. If you have been doing Kegel exercises for weeks, months, or years and not getting the results that you are looking for, here is your permission slip to never do a Kegel exercise again. So now you're probably saying, well, Dr. Amy, what do I do if I don't do the Kegel exercises? What we want to do is take a holistic approach to dealing with your pelvic floor. The first thing I want you to do is work on your posture. When you are in that correct position, which is head over shoulders, shoulders over hips, it allows that pelvic floor to rest in a neutral position, which decreases tension and also decreases stretch. So it can actually function appropriately. After you work on posture, the next thing to work on is breathing. You want to make sure you're doing that deep diaphragmatic breathing because that will help to keep the diaphragm moving correctly, which will also decrease stress to the pelvic floor. So to do this, you want to take that deep belly breath in through your nose. You want to breathe out through your mouth like you're blowing out a birthday candle. And the next thing you got to do is get moving. Walking is the best exercise for your pelvic floor because it gets those hips moving, which causes a passive contraction and relaxation to the pelvic floor. However, whatever cardio exercise you really enjoy doing that you will do on a regular basis, do that. That will help to bring blood flow and nutrition to the pelvic floor so it can start healing. And the last pillar that we need to knock over is mindset. We've got to change our mindset, ladies, that just because pelvic floor dysfunction is common, particularly after we have children, it is still not normal. We deserve better. We deserve to not have to wear pads for the rest of our life to make sure that we don't have an accident. Now, you may be thinking to yourself, well, I only have to wear a pad if I'm going to be running, jumping, or high impact activities. And that's fantastic, actually, because this is the best time to deal with your pelvic floor dysfunction. You see, what happens is that people think, oh, this isn't too big of a deal. I can wear a pad when I know I'm going to the trampoline park. However, chances are good that it's going to progress over time, and it will get to the point where you have to wear a pad all the time. And then it gets to the point where a pad is not enough and you have to start looking at other options. Trust me, ladies, I do not say this to scare you. I do this because these are the people who show up in my clinic, who have been having to wear pads for years and years, who have not been able to do things like go to football games or play with their grandchildren because they're afraid of leakage. They finally get to a breaking point where they will do anything to fix this problem. Now, I'm glad to be able to offer them help, and I'm glad to be able to get them back to doing all of the activities that they love doing without leaking. However, what I would really prefer is to have seen them 20 years before, because it makes the whole process so much simpler. Dealing with the beginning signs of pelvic floor dysfunction when you're in your 20s and 30s is way easier than when you're in your 50s and 60s. Now, if you'd like to learn the pelvic floor exercise that I recommend instead of doing Kegel exercises, I'm going to have you go check out this video over here. And if you are a pelvic floor physical therapist or a manual physical therapist in the Maple Valley, Washington area, and you like what you're hearing on this video, I'm going to encourage you to send your resume and cover letter to Dr. Amy, DRAMY, at PT4EB.com.